Well, welcome to this Shaw Spotlight, a new show on Shaw Spotlight called the Sunset Family Health Team. And today I have with me Barbara Pernsky. She's a nurse practitioner. And I'd like to just get a little bit of background on you. You're a Kenora girl, right?
I am a Kenora girl.
And so first you took your nurse's training at the university, like you got your Bachelor of Science in Nursing.
Right.
And then what made you swing into a nurse practitioner? And when did that happen? And when did you come here as a nurse practitioner?
So I've been working as a registered nurse for 41 years.
Oh,
and
wow.
I was based really, a majority of my learning and working was at the Lake of the Woods Hospital. And from there I thought I would advance my education and take the nurse practitioner. I took that through NAWSOM program, and that was about 13, 14 years ago. And so I've really enjoyed my work as a nurse practitioner here, and I feel quite honored to work within the community that I live and I've grown up in.
Well, we're honored to have you. And I must say, too, I'm going to take a little freedom here and say that you want Barbara or Mrs. Pernsky?
Doesn't matter.
Okay, Barbara's been my nurse practitioner, and she's just done wonders for me. So I'm very comfortable talking to her about this to get us started. So let's just quite get started on the So now, exactly what does a nurse practitioner do?
Right. Now that's a really good question, because there is sort of sometimes a lack of information out there. What does a nurse practitioner do? So a nurse practitioner is a registered nurse that has been trained in advanced skills in assessment and treatment of patients with chronic illness and some acute illnesses as well. Many of us do work in primary health care, but in other centers within Canada, people do work in neonatal units and such. But in Kenora, we have primary healthcare nurse practitioners.
Well, that's wonderful then to know that. Now, so I think we've kind of almost covered, like, what does a nurse practitioner do? Or, no, maybe we haven't. Like, first you have to diagnose, so start there. I come in with my bad back. Okay, let's use that for example. So where do you go from there? I just come to you and say, my back is just killing me. I can't stand the pain.
Totally. So when someone comes to see us, everyone is, we have an EMR, which is a short acronym for electronic medical records. So we don't do paper charts anymore. So everything's on the computer. And so the first thing we do is we assess your back. We assess the history of your back discomfort. And the pain level and these kind of things. We also provide, nurse practitioners especially provide holistic health care. So we also, during a visit, we look at social issues, any allergies, any family histories, any surgeries. We also look at the cancer screening. There's set cancer screenings for men and women. We also look at the immunization status of a patient too.
Oh.
So we don't just look at that one problem that a patient comes in with. We look at holistically, emotionally, physically, how are they doing? And because any illness does affect their entire life and their well-being. So from the assessment, then we would collaborate with the patient and develop a plan of care, what we would be doing for that patient. Sometimes it's ordering blood tests. Sometimes it's ordering diagnostic imaging, which is like x-rays, those type of things, ultrasounds. And then sometimes it's ordering medications for patients and recommended. Right. So it just the whole gamut of assessment right through to a collaborative development of a plan of care. We really try to empower patients with the knowledge of what the issue may be, what the results of the testing that we may have ordered, and what the expected plan and recovery period would be. So it's most of what we do, many hours or times of our visits, we really talk about education and how to improve the total well-being of a patient.
Okay, and that's all under the title of holistic.
Holistic,
I didn't really know
absolutely.
what that meant, so I'm glad, even to me, you always learn something in this job. I've heard that word so often, but I didn't know it encompassed so many things on a person. So that's really a great answer for it. Thank you so much.
You're welcome.
So anyways, to do all this, how many nurse practitioners do we have in this area? Maybe right here at the Sunset Family Health Team.
Right. So actually, it's been growing, unbelievable, the number of NPs we have. So we have a total of 7 NPs.
Okay.
NPs is an acronym or a short form for nurse practitioners. So a lot of people call nurse practitioners NPs, and that's fine. But just to clarify for your audience that that is what an NP is. It's a nurse practitioner.
Okay.
So we have 7 in at the family health team. So
That's right here.
and
the
that's
Batterson
here.
Clinic.
Right.
Okay.
So what is interesting is, and it's helpful for the community to know, that there's 3 different sites for the family health team. So we have a family health team site at Keewatin Clinic. We also have one at Dockside, and then we have nurse practitioners here. Just over this winter, there's been another site called the Family Health Team Nurse Practitioner Clinic.
Oh.
And so what I'm going to do, just to kind of explain how do people access each one of those communities as well, I'm going to say who's working at each one of those communities, if that's okay with
Yes,
you.
it is. It's fine.
So let's start with
Just before you do
Dockside.
that, I was just going to say, like, I didn't know about this Dockside. Like, I knew. Tell me where it is, because then I'll understand a little
Right. So Dockside is a physician clinic that is next door to the Inn of the Woods.
Okay.
And Dr. Daly used to be working there, and Dr. Fedor is still working there. But in the last few months, they've hired Leanne, who's a nurse practitioner, and she provides care full-time at Dockside. So if someone is rostered at the Dockside with Dr. Fedor, they have access to the nurse practitioner. So how they access Leanne is that they would phone Dockside Clinic because they're already rostered there and ask to see the nurse practitioner.
Okay.
I go out to Keewatin Clinic myself, and I go 1.5 days a week. And Keewatin Clinic, as I say, is also part of the family health team. And if you are rostered in Keewatin with one of the physicians there, then you have access to the nurse practitioner, which is myself. And how you would access that is you just phone Keewatin Clinic and ask to see the nurse practitioner.
Very easy. Yeah.
Then here at the family health
Let's
team,
just
this
stay
site.
just that one for a minute. The Keewatin one. Like, is that what do you go say every Tuesday or?
Right. So my days of the week are Tuesday all day and half day on Thursday.
Oh, okay. So
Yeah.
now you can slip on.
Right.
I wanted to make sure we got that in. That
Yes, very
don't
good.
phone on a Friday and want to get
that day.
Barbara Pernsky, the nurse
Absolutely.
practitioner.
Right.
Okay. So then.
So if it happens that you're rostered here at the Patterson Clinic with the physician team, then that means you have access to the nurse practitioners that work here. And the full-time nurse practitioners are Michael. The next one is Carol, and then myself. I'm here the rest of the week that I'm not in Keewatin. So if it happens that you would like to see a nurse practitioner, what you do is you phone your family physician line. You phone the Patterson Clinic, which is 468-3021, and they give you prompts of what physician you are rostered with. Then you talk to the support person at the front desk and you say, I would like to see the nurse practitioner.
Okay.
And they will fit you into an appointment with one of the nurse practitioners. But you must be rostered with one of the doctors here.
Oh, okay. So
Yeah.
there's someone that doesn't have a doctor, like there's quite a few people that
Right.
they're just out of luck to
Well,
get you.
What happens
You're
if
any of the
anyone,
7.
right? If it happens that someone does not have a primary care provider, what happens is that you must register for Health Connect. There is some new physicians that have moved to Kenora, which we're very fortunate to have lovely new physicians. And we also have a nurse practitioner clinic who are also rostering their own patients. And so if you're have already got your name on Health Connect, then they will be taking patients from that list on Health Connect. So people must be rostered with the Health Connect. Or
I
have
never
their
even
name.
heard of this Health Connect. Is it something new?
It is something that's been around a fair number of years. However,
really?
it was not implemented as well as it could be.
Oh.
So I don't have the phone number in front of me, which is unfortunate that I don't. But at your next interview, we'll make sure that person gives you the phone number, so you could make sure that people in the community have that number.
Yes, because that's important for them that don't have a physician.
Totally,
Yes.
totally. And there is hope that if everyone puts their name on the Health Connect list, that hopefully everyone will be able to get a primary provider that way.
Well, that's great.
So I just wanted to explain the last nurse practitioner access, and that is it's just brand new. It's the Nurse Practitioner Clinic. It's really the Family Health Team Nurse Practitioner Clinic. There is 3 nurse practitioners that work there, and they roster their own patients there.
Oh.
So one nurse practitioner is Kristen, another nurse practitioner is Holly, and there's a third nurse practitioner, Kate, who will be starting in the summer. And they've already starting to roster patients. Their clinic is at the Patterson. It's in the lower level, right across from the surgeon's office.
Oh, yes, okay.
And so that clinic is just starting to bring in patients that are on the Health Connect list. And if you need an appointment with them, you would already know that you're rostered with them, and you would just phone their clinic and make an appointment with a nurse practitioner.
Okay. So that's 3 more. So that you had there's a total of 7 right now at the Family Health Team. So when the 3 more come, that's going to be 10 nurse practitioners here. Or was those 3 involved in the 7?
Yeah, the 7 is all of the ones that I just mentioned.
See, I didn't understand that. Okay.
Yeah.
So we cleared that one up then.
Good.
Thank you very much.
You're welcome.
I thought, aren't we lucky we're going to have 10 of you? Now, there's a question I want to ask is, how can we improve say my visit with you if I have to see another healthcare provider? Do you make the arrangements? Do you phone and set up an appointment? Do you give me the number and then I go home and phone? Or how does that work? Or do you go through the computer and say, I have a Ruth Bowick here who needs to see you about some problem?
Okay.
How does that work?
So if it happens that you come and see me and you need to see the hypertension clinic or the asthma clinic or the diabetic clinic, what I do is I refer internally, and then the support staff at the Family Health Team will phone the patient and book them in to see one of the other members of the team. The Family Health Team is a large team.
It seems to be. My goodness, I didn't realize.
Exactly. And there's many different disciplines. Very much the healthcare model in Kenora is becoming very team-based. And so we have physicians, of course, but on the Family Health Team, there's registered nurses, there's RPNs, which are nurses as well. There is a COPD clinic, an asthma clinic, an INR clinic, a hypertension clinic.
What's INR before you go on?
That's for people that are on Coumadin or warfarin, which are...
That's hard?
No, it's for monitoring drugs. Monitoring drugs for someone who is on anticoagulants.
What's that called? IR?
INR.
INO, okay.
And there's a social worker. We have a dietitian.
All here in this clinic?
All in this
My
clinic.
Goodness.
So the team, your health team, like your health team, is whoever your doctor is, but it's also all of us nurse practitioners. It's also if you ever need help with blood pressure or asthma, we're all part of your team. You're also a main part of the team.
Which makes us, the patient, feel very comfortable, I would think, because I'm certainly comfortable knowing all this, and through you I have been referred to others, and they welcome me with the open arms and kind of nice warmth and everything. I'm very comfortable with them all.
Well, I'm glad to hear that.
I was thinking you're getting as big as the new Ford government's doing for Ontario. Did you see he's going to load everybody all together in one big lump? So if Kenora keeps on that way with the wonderful services that we're having just through this, it's just fantastic.
Yeah, I feel very positive as a nurse practitioner that things are moving towards increased access to care and timely access to care, and it's a bigger team, and so it's nice to know that if your physician is busy and you can't get in to see them, there's a whole team of health providers that are there to support you and encourage you and to make increase your access.
And the person knows, because when she phones for something, she knows what's wrong with her, what she's going to ask for. So with all these people here, it doesn't take much for, if you can't get, like, say, your physician, to find it, get in touch with the person here, of all, so many of you, that will suit my needs.
Right.
You know? Yes.
Right.
That's good.
So, and to clarify too, if you are a patient who's rostered in Q8 or a patient that's rostered at Dockside, or if you're rostered with the nurse practitioner clinic, you all have access to all of the services that are available, and there's no cost to any of those
Isn't that
services.
wonderful, though?
They're just all part of your healthcare team.
You know, what a wonderful country and province we live in. And
Yeah,
to have
we're very fortunate.
But people, like for seniors, this is geared to seniors, 55 and up, you know.
Right.
I mean, 55 is the 35, and I'm in my 80s, like that's considered like 70 or 60 now. So we're still quite young. But you know, we starting to develop these problems.
Right.
And I'd like to, this is good, because then people of my age, you know, and, well, not 55, it'll be a long time since I've seen 55, but anyways, you know that this is here for us. And that's important to people as they get into that senior group.
Absolutely. And so part of one of the things with saying that, it's important that when you do come in for your appointments, how to make it more meaningful for everyone, but including seniors. And so, you know, we've just got some ideas that maybe would help a person when they come into a health visit. So one of the things to do is to always bring your medications. So the medication, we do have a list of the medications on the computer. However, sometimes it's not as current. It's not really exactly what a patient is taking. So when a patient brings all their pills, not just a list sometimes is not all inclusive. It's not all inclusive.
You have to see the label on the bottle.
Right. So it gives us an opportunity to revise the medication list, so all the team members, including the physician, is really aware what exactly is the patient taking. It also gives us an opportunity to really teach and share with the patient what those medications are for. You know, because sometimes people are ordered a medication, they're not really certain what it's for, and it's confusing. Absolutely. And it gives an opportunity for a patient to ask more questions too.
Like, what would be side effects could I expect from this particular pill or something? Because that's kind of important, because sometimes a pill will make you, it's not going to make you feel as good as you thought you'd like to feel getting this pill, but it could make you feel dopey or, you know, or anxious or something. So that would, by just having this list here on the computer, you can exchange things too then. You can take them off something and put them on something different if they have like some... So when a patient comes to an appointment, it doesn't matter really how old they are. It's just important to bring the medications. You just have safer care and improved overall outcomes when a patient has been informed about what they're taking. We really know exactly what they're taking. It's just overall health care is improved that way. Another thing a patient can do when they come for an appointment is always bring, you know, a family member or a support person. So sometimes when a patient comes in is that there's lots that is shared, and it's hard to remember everything. And so when you bring someone else with you, it just really improves the increased knowledge and sharing and communication with the patient. And that person could ask a question of you as well as the patient themselves and say, like, I really didn't quite understand what you told me. And this is my mother, and I'd like to know, you know, a little more about it. So you're quite willing to explain to that. Yes.
Yeah, that's excellent if they do that. Another thing that is very helpful for many patients is some people wear eyeglasses. Some people are supposed to wear hearing aids. Sometimes they come for appointments and they don't have their hearing aid. So it's really you know, it's not as effective an appointment because the patient really doesn't hear anything you're saying.
So they don't know.
And you know, if they can't see, if they're not wearing their glasses, so it does you know, hinder the effectiveness of the appointment. So I encourage everyone to bring those kind of aids.
I would never have thought of that. I mean, I didn't, because I wear my glasses and I don't wear a hearing aid, but I heard that a lot about people with hearing aids. They often don't wear them.
Yes.
You know, and that's really sad. They said it, but some of them say it bothers them or something, or they just can't be bothered putting it in, or I don't know. But I mean, if you want to hear, like to me, I'd want to hear everything.
And so sometimes if a patient can't hear with their hearing aids, you know, we can help them out on figuring out why that is. You know, send them back to the Hearing Society, which can do a good assessment to see if they're not fitting well or they're broken or something like that. Another thing thing that
Speaking of that, may I just interject for
Sure.
1 minute? Is there a hearing clinic in Kenora then?
There is a hearing society in Kenora.
Where is it?
Well, I couldn't
I
give
hate
you
to
the
get off
exact
track,
address, but that's another thing to bring up to the next interview
The one
that you
that's coming.
have.
Oh, okay.
But if you Google the Kenora Hearing Society, there is an audiologist that works
I didn't
there.
know that. I was wondering.
You don't need a referral. People can self-refer to that.
Okay.
Yeah.
So the next person coming in is, who did you tell me now?
So the next person is June. So
June.
we can I'll remember this. And so I can write it out and you could bring it up when you...
I will do that then.
at the initial part of the next one.
I didn't know we had an audiologist here. Right?
And I'll get the phone number for you too, so
that'd be
people
great.
can just
Yes.
phone.
Okay.
But you can Google if you feel you want to Google. It is in the phone book as well.
Yeah. Well, I like Google.
But it's right here downtown in Kenora.
Oh, okay.
Yeah, and you do not need a referral from a health provider to go.
Okay. Oh.
Yeah.
Who
And
funds that? Our Ontario government too?
Yes.
Oh, okay.
Yeah. Absolutely.
No, I see. I'm always learning. So I love doing this job because you learn so much. Yeah.
So one of the other things that
Are we still on how to improve our visit with the nurse practitioner?
One of the other things that I do promote is empowering patients to know what tests they've had, where they are in their immunization status, just their
Really?
past history. So I do encourage patients to keep a health binder. And in the health binder, you would put things like your medications. If it happens that you have diabetes, for instance, so any of your chronic diseases that you may have, maybe some of the testing, maybe the name of your doctor, maybe the name of your health providers, that you might have a whole team of health providers who you see on a regular basis. This really helps patients to be empowered with the knowledge of their health. We have to remember that we have to be the engineers of our own health train. We are the ones that are going to direct and are in charge of our own health. So if it happens that a patient has lots of different specialists that they see, it's a good way for you to bring your health binder to your specialist. If you go to emergency, you would bring your health binder to emergency. Because when you're unwell, you would forget, I forgot, I had this test and I forgot the name of my doctor, for instance. So you would bring the health binder with you to decrease anxiety and worry that you're going to forget important facts of your health care. So it's really important to, and you can write it out like just a school binder.
Because if you asked me right now, when was my last bone density test, I couldn't tell you. I know I've had some. And when was my last immunization? I haven't a clue.
Right.
So, and how would I have to phone you to find out to start the binder?
Right.
Because,
so when you come in for a visit, if you don't have a health binder that keeps track of everything, then we can have a conversation about that. And it's just a school binder with rings on it. And then you could ask for the results of your bone mineral density if you would, if you want that. And on there, whoever your health provider is, they can mark the next bone mineral density should be in 2020, for instance. And then once you have in the binder, you don't have to worry about forgetting things because as all of our lives are busy, and it's a full-time job looking after ourselves. You got eye appointments, you got hair appointments, you got dentist appointments. It's hard to remember everything, and then we do have things like our immunizations that we have to keep updated. So it's hard to remember everything. So and like I said previously, we really have to be the engineers of our own health train. You really have to come in and say, I think I'm due for my tetanus this year because it's been 10 years. We need a tetanus every 10 years.
10 years, eh?
Yeah.
Okay.
So it's just a little bit different than what we used to years ago.
Yeah.
It doesn't mean that we don't keep a record in the chart, absolutely. But we want to empower patients with the knowledge of what they need to be doing to keep healthy. And it's your body, it's your life, and you should be the one that knows, when your testing should be.
Yes, and we're all living to be quite a bit older nowadays, so you want to be healthy in those old years. You don't want to be like stuck at home, you can't get out and stuff like that because you didn't look after yourself properly. But I want to get back to that binder just for a minute.
Sure.
So supposing I start keeping one, now maybe I should have it like on my coffee table so that, say, in an emergency, the ambulance comes for me, if I was coherent enough to say there's a red binder on that coffee table with all, wouldn't that be something good?
It would be great. So if you happen to ever go to emergency by ambulance, they're going to ask for your medications because they want improved outcomes for you. So what you're going to do is you're going to bring all your medications, but to bring the binder will really assist the emergency staff, emergency physician to improve and provide safe care for you. Yeah.
Well, then we're just about running out of time here, so I just wanted to mention something on the last page, Barbara, that I had written out for you that you got here. Engage in memory exercises such as crib, bridge, reading books, news, something like that. So, and to learn a new skill such as bell ringing, I think that's just wonderful. So when especially when people 55 over come to you now, do you kind of, in a nice way, get onto this with them? Say,
I do try.
Like you're 60 now, maybe there's something you could be doing, joining a bell ringing club or a reading book. So
people work really hard or try to work really hard to maintain their health and improve their health. So eat healthy, stop smoking, keep moving your body. Exercise, involved in social events, whether or not it's going to the Seniors Horizon Center, involved in the church, maybe involved in the ski club. Very important to keep your brain alert and exercise your brain. Your brain's a muscle. You have to keep exercising it. So things like puzzles and reading and doing Sudoku, those kind of things are really important. It's very important to keep your immunizations up to date. It's very important to make sure that you wear your safety devices, such as if you go skiing, wear your helmet, or if you ride a bike, wear a helmet, wear your seat belt, wear your life jacket in the summer when you're in the boat.
So many of us don't want to do that.
Exactly. So it's really important to, just really focus a lot on maintaining your body and living healthy, boosting your immune system, laughing a lot, hugging your friends, getting a good night's sleep. And everyone knows that, really curb alcohol and drug intake because that can cause some brain dysfunction and such. So, the whole essence is to enjoy life, find joy every day, and keep moving and enjoying the great area of Kenora that we live in.
Well, now that we got 7 wonderful nurse practitioners here like yourself that have good enough to go on to the Shaw's Spotlight. I got to get that in. Shaw's Spotlight from the Sunset Family Health Team. I want to thank you for taking giving me the opportunity to discuss all this for cable to be on Channel 10, in the near future. So thank you so much, Barbara Pernsky, nurse practitioner here at the Sunset Family Health Team. Thanks again.
Thank you.
And I shall return with another section from the Sunset Family Health Team. Thank you. Goodbye.